Assalamu alaikum. This inshallah will be the first lecture in a series of 4 short lectures that target nurses in hospitals in Kuwait to understand and navigate blood bank services. These lectures could also be of use to other nurses in other countries, especially if they are new to the profession. In this lecture, inshallah, we will recognize services and products available at the hospital blood bank and then identify products and services that must be requested from reference labs and then understand the process of such requests. We will also understand typical processing times, logistical considerations. We will try to understand what affects the availability of blood products, become familiar with different request forms and when they are needed, and then describe the sample requirements for each type of blood bank request. To start, I think it's very important for nurses to understand the role of the blood bank. I think if the nurses understand how blood bank technicians think and operate, then they will be able to make decisions that will ultimately help the patient. In the blood bank, our primary goal is to ensure the safe and effective provision of blood products to patients. Now, most blood banks offer red blood cells, plasma, platelets, and other plasma derivatives. If you are in Kuwait, most blood banks will have all of these products. If you are not in Kuwait, it is always worth asking what are the products that are offered by your local blood bank in your hospital. How does the blood bank achieve its goal? Through careful testing and screening to prevent immune reactions and to ensure compatibility. Now, what makes the responsibility of the blood bank technician complicated? That is the immune system, both the immune system of the donor and the immune system of the recipient. Why does the immune system make our life complicated? Because the immune system is made up of all of these different types of cells. Those cells are different in what they do and how they do it, but ultimately they share one goal, and that is to protect the host. Now, when they come in contact with any transfused component, and I have here a red cell just for illustration, when they come in contact with it, they come in contact with all of what's known as antigens that are expressed on the surface of the transfused component. Once they come in contact with these antigens, they have to make a decision to either tolerate or eliminate. And that leads to what we know as a transfusion reaction. Transfusion reactions don't only happen in response to the transfusion of red blood cells. Every single time we transfuse any component, we are introducing a foreign biological material into the system of the patient, which means that we will have a possibility of a transfusion reaction, which is a fancy way of saying an unfavorable outcome. So what does compatible versus incompatible transfusion mean? Because you will hear those words a lot around any transfusion that you will be a part of. In 2 patients where we are introducing a transfusion, the transfused component will enter the circulation and it will come in contact with the immune system of the recipient. Once that happens, the immune system will either decide to tolerate, and that's what's known as a compatible transfusion, or it will decide to eliminate. And in this case, this is what's known as an incompatible transfusion. So what makes the immune system decide to tolerate and what makes the immune system decide to eliminate? 2 things: the antigens and the antibodies. And that refers to the antigens in both the recipient and the donor, and the antibodies in both the recipient and the donor. Now, as nurses, you know the very important antigens that are known as A and B. Some of you will know a third antigen known as RHD. What most nurses don't know is that there are 48 blood group systems, and between those blood group systems there are over 300 different antigens. 300 beyond the A, the B, and the D. The doctors and the nurses don't know many of those antigens, but as blood bank scientists and technicians, we have to be aware of all of those antigens. And we need to be aware of any antibodies that correspond to those antigens in either the donor or the recipient systems. And we play a game of match. We need to match the correct component to the correct patient to be able to avoid the activation of the immune system, which leads to elimination. So what are the tests that are done in the blood bank? We have what's known as a full profile. And in most countries, when you request a full profile, the blood bank will perform an ABO, an RHD type, and they will perform what's known as an antibody screen. But they will not cross-match or prepare blood for your patient. So we will know where your patient stands, but we will not prepare blood for your patient. What is the ABO and RHD? This is the test that tells us, is your patient, for example, an A positive or an O negative, etc. What does the antibody screen tell us? This one will tell us whether your patient has any antibodies in their system. If the patient doesn't have any antibodies, so the antibody screen is negative, then your patient is going to be a straightforward case, and the cross-match should be straightforward. If your patient has a positive antibody screen, then we know that your patient has antibodies, but we don't know what the antibodies target yet. And as a consequence of this coming up positive, we will require to perform another test known as an antibody identification to be able to identify what the antibodies are, to be able to prepare blood for your patients. When you request a cross-match, then we will choose specific components from our stock based on the results of these two tests, and we will perform one final checkpoint to make sure that on the bench at least the transfusion looks compatible. Beyond this, we have another test known as a DAT, a direct antiglobulin test. Most countries at the moment have very strict policies to when this test is produced, mainly because there is a number of false positive results that come up with the DAT. So it's only performed when it is absolutely needed. In Kuwait, for example, we perform a DAT if we are suspecting a hemolytic transfusion reaction or following a transplant. This test looks at whether the red cells from your patients are already coated with antibodies in vivo. The antibody identification, as we said earlier, identifies the specificity of the antibodies, and it's only performed if the antibody screen is positive. Antenatal testing is a test that is required for every pregnant woman during her first trimester, and it is performed to figure out if the pregnant woman has any antibodies in her circulation and her blood type and her RHD phenotype. Those test results are required for the doctors to decide how closely the lady will need to be monitored during her pregnancy. or if she requires to take any medication to avoid any complications. And then we have an array of other special tests. In Kuwait, the antibody identification, the antenatal testing, and the other special tests are all performed in what's known as a reference lab. And in Kuwait, we only have one reference lab, which is Kuwait Central Blood Bank. Processing time. Now, in most hospitals around the world, samples are processed as a first come, first serve basis. The workload will vary and the labs will be short staffed outside of official hours. So if the test takes 1 hour during official working hours, it might take longer outside of the official working hours because of staffing. So if you have samples that are urgent, you need to clearly state that these sample processing is urgent, so your samples can skip the line. With that said, you need to keep two things in mind. One, you need to know your local hospital policy. Some policies will have an electronic system that is enough to inform the lab of the urgency of the sample. Some hospitals will require you to give them a call and tell them that your sample is urgent. With that said, please consider not to say that the sample is urgent unless it is really urgent. And I need you to understand something here. When you label your sample as urgent, it will skip the line and it will take the time of the technician or the scientist in the blood bank away from other patients. If other patients are really urgent, they will be delayed because of your sample. And therefore, you will not benefit your patient because your patient wasn't really urgent. And at the same time, you may have affected the safety of other patients. So please do not mark samples as urgent unless they really are urgent. In typical situations, performing a full profile requires an hour. Performing a cross-match requires another hour. Samples and forms. It is very important for you to choose the right tube for the tests required. If you are requesting an ABO, an RHD, and a screen, in most cases, most hospitals around the world, you will require an EDTA tube. If you are dealing with a patient that has known antibodies, or if you send the EDTA and the antibody screen comes up positive, then it is very likely that most hospitals around the world, and all hospitals in Kuwait in that case, will require a plain tube as well. So as a tip, if you are a nurse that's collecting samples and you already know that the patient has antibodies, for example, some patients are aware of this and they will tell you, I have antibodies, then it might be worth collecting both the EDTA and the plain tubes together. This way you save yourself time and you save the patient from having to go through the process twice. Correct labeling of samples. The samples have to include all the required information. You have to label the sample at the bedside. Don't collect the samples, walk away from the patient, and then label the tubes at your bench. It is very important for the safety of the patient that you label the tubes at the bedside. It is also very important that the tube is labeled by hand, has a date, a time of the sample collection. Remember those antibodies that we talked about? All of those 300 antigens on the corresponding antibodies and the ones that make the life of a blood banker very complicated. Those antibodies tend to disappear after 72 hours because they are proteins and they can denature. So samples in most countries around the world and in all hospitals in Kuwait, the samples for any blood bank testing have to be processed within 72 hours of the sample collection time. For us to know when the sample is collected, we need to have this information on the tube. Now, if you have several patients, you've been very busy, so you're going from one patient to another and you are collecting samples, and all of a sudden you realize you've collected your first sample 5 hours ago and you are just sending it now to the lab. That's completely fine. The lab will gladly accept it as long as it doesn't have any clots, as long as it's properly and completely labeled, then that's completely fine. But we need to have the date and the time, and it must be signed by the phlebotomist. The correct forms. There are in most hospitals what's known as standard forms, and there are the special forms. So let's talk about forms a little bit. Most hospitals will have what's known as a standard blood transfusion request form. In Kuwait, all hospitals will have the exact same forms that come from our only reference lab, which is the Kuwait Central Blood Bank. For the standard blood transfusion request form, the tube of choice is the EDTA 5 ml blood. If you are not in Kuwait and you are not for sure aware of this, it is always worth checking your local hospital policy. It must include a diagnosis. We need to know. Remember those 300 antigens and all the antibodies? That is not the only piece of information that nurses and doctors are not aware of. The world of blood banking is very complicated, and we base our decisions on so much basic information and science. You are not aware of it, but we are aware of it. If the request form includes a clear diagnosis, then the blood bank staff will be able to assess your request, and they will be able to tell you if you should have made a special request or if what you are requesting is unreasonable, for example. It must be accurate about the urgency, just like we mentioned earlier. It must be validated by the requesting physician. So depending on where you are in Kuwait, we need the physician's stamp and signature. So depending on where you are, you need to be aware of the full validation process that's accepted by your local hospital. And the transfusion history is very important. If it's not written in the patient file, it is always worth asking the patient if needed. Knowing if the patient had received a transfusion previously or not does affect the decisions that we make in the blood bank. And the hemoglobin is also important to include on the request form if it's available. And if both the CBC and the components or the blood bank investigation have been requested at the same time, it's worth noting on the form that the hemoglobin has been requested, but don't say it's 0. These are two examples of missing or inaccurate or ambiguous information that's usually included and which hinders the job of the blood bank scientist and makes their job harder. Number 1, if in the diagnosis it says things like pre-op, because pre-op is not a diagnosis. If the indication is empty, that's also not helpful. If the diagnosis includes abbreviations, now a blood bank staff will know a lot about antigens, and they will know a lot about antibodies, and they will know a lot about hemodynamic stability and blood components, but they will not necessarily understand all abbreviations for every single type of operation that can happen in the hospital. So we need to know the full form of the diagnosis to be able to understand and to be able to make decisions that ensure the safety of the patients. Antenatal case is also not a diagnosis. The last time we checked, being pregnant is not a disease, and having an operation scheduled is not a disease. We need to know exactly what the patient is suffering from and why they require the blood to be able to make better decisions and make this process of transfusion safer for our patients. The second type of form is an emergency release form. A variation of this form will always exist no matter where you work. In Kuwait, again, it's the exact same form as I'm showing here in all of the hospitals in Kuwait. This form is deliberately designed to scare doctors. This form says that I will sign and stamp to show that I understand I am not allowing the blood bank any time to perform any of their tests because my patient cannot wait even 45 minutes and they require the transfusion right now to save their lives. It is designed like this on purpose to give the physicians the chance to pause and think. Does my patient really require the blood right now, or can I wait 45 minutes to perform the tests urgently and to make this entire process more safe for my patient? This form, the non-group specific form, on the other hand, is not supposed to scare anyone, but usually it does. This form tells the receiving doctors and the nurses that the blood component that you are receiving is not the exact group as your patient. However, it is compatible and it is safe. For example, if your patient is A negative, and that's a very rare blood group, and I don't have any A negative in my fridge, in my stock, then I can give you an O negative. I would have had enough time to perform all of my tests. I would have had time to perform a cross match, and it does seem compatible. So this is safe, but I'm giving you this form to tell you, yes, I understand that your patient is A negative and I've given you O negative, but I've done it on purpose because that's the stock that I have available. And then we have the least incompatible units. Now, a lot of nurses will go through their entire careers without seeing this form once. It's not used very, very often. It is used when we cannot find any compatible units for the patient. It's done when we are dealing with one of those rare events where a patient has autoantibodies that recognize high frequency antigens, for example, so they would be reactive against 99.9% of the population, or when our patient has multiple antibodies and it is almost impossible to find a component that's negative for all of the corresponding antigens. It requires a signature and a stamp, and it is again designed specifically to make the doctors pause and think. Can I do anything else? Can I help my patient without giving them this transfusion? Or is this transfusion really life-saving? Then we have the immunohematology reference lab form. This form will always exist for all of the tests that are not available in your local blood bank. Sometimes the form will include a list of the tests and the corresponding required samples, as is the case for the form we have in Kuwait. Sometimes it doesn't. Now, if you are in a country where your form doesn't have this very, very useful table, You should always ask about the exact requirements for special tests if they are the types of tests that you haven't come across before or you don't know exactly the samples required for them. And then we have the transfusion reaction investigation report. This is a report that has to be filled out every single time you either have a confirmed or even a suspected transfusion reaction episode. And we will talk about transfusion reactions, inshallah, in another one of the recordings in this series. And then we have the antenatal serology laboratory request. So this again is another form that has to be filled out for all the antenatal testing. Regardless of the form you are filling out, it is very, very important that you include all of the information requested, including things that don't seem very important at first. For example, here it's asking for the hospital code and the hospital name. This is actually very important because every time you send a request or a test to a reference lab, you need to be aware that the reference lab will receive samples from many hospitals in the country you are in. So they need to be able to tell where did this come from so they can communicate and send the results back effectively. It is also very important that you fill out the patient information very carefully. You cannot use correctors, for example. You cannot erase some of it and then write on top of it. It either doesn't have any of this, or if you cross out something, you need to put in an initial next to it and then clearly write underneath it the correct information. Those details will vary slightly from one country to another. So again, I do advise that you go around, ask about the available policies and read them. Reading policies and being aware of the available policies is very important for two reasons. Number one, if you read the policies, you will be able to ensure the safety of your patient at best. Number two, reading the policies will protect you because you will know all of your responsibilities and you will have a legal basis for all of the decisions and the processes that you follow. And that is it for our first recording. Now, I have deliberately done this recording only in English to target anyone that can listen to it. With that said, if you wish for me to make these lectures available in Arabic as well, please let me know and I'll be happy to make two recordings, one in English, one in Arabic. Thank you.